A school-aged child should be able to perform some basic activities of daily living, such as holding a toothbrush to brush their teeth. Most importantly, be able to hold a pen to write. Cerebral palsy is caused by damage to the brain during birth or during the first year of life. Occupational therapy role cannot be overemphasized. Though the brain damage in cerebral palsy does not seem to worsen, but without treatment, the symptoms will nearly always persist throughout the person's life. Most school-aged children with cerebral palsy often demonstrate problems with fine motor skills instability due to poor balance and coordination. And also, most children knows that they have poor motor imbalances, which affects them psychologically because they will want to write like every other children in the classroom, but they are unable due to their impairment. A school-aged child should be able to perform some basic activities of daily living, such as holding a toothbrush to brush teeth, holding a plate and a spoon to feed independently, button shirt, lace shoe, dress and undress himself independently, be able to hold a cup and drink from it, and most importantly, be able to hold a pen to write. But children with cerebral palsy finds it difficult to perform these simple tasks because activities of daily living demands fine motor skills functions. Now, what is cerebral palsy? So I will just explain cerebral palsy in a layman's language so that anybody that comes across this video would understand what it's all about. Cerebral palsy is a disorder that affects muscle tone, movement and motor skills, the ability to move in a coordinated manner and in a purposeful way. Cerebral palsy can also lead to other health-related issues including hearing, vision, speech and language, and learning disabilities. So let me explain fine motor skills. What is fine motor skills? Fine motor skills generally refers to the actions of the hand, wrist, arm, including dexterity, coordination, and strength. Handwriting is a complex process of managing written language by coordinating the hand, the eyes, pencil grip, letter formation, and body posture. Cerebral palsy affects muscle tone, movement, and muscle skills, which leads to difficulties in effective use of fine motor skills in performing activities of daily living and performing school tasks due to the non-progressive brain damage early in life. Cerebral palsy is caused by damage to the motor area control center of the developing brain. It can occur during pregnancy up to 75%, or during childbirth 15%, or after birth up to the age of 3. It is a non-progressive disorder, meaning the damage to the brain does not worsen, but secondary orthopedic difficulties are common. Cerebral palsy may not be noticed immediately after birth, as children with cerebral palsy are slow to meet the developmental motor milestone at which certain functional skills are achieved.